Hi, this is Gary Orris coming at you again with another second opinion. I'm going to give you what update we have with the Aetna Medicare issue. Is we don't have an update. We had the appeal. It was very unenlightening. All they were concerned about was whether or not I felt discriminated against by them canceling me. Instead of anything to do with our practice. They did stress that it has nothing to do with the way we practice medicine and that we have great reviews and there's no issues there. So the bottom line is, Aetna's bottom line is that must save them money by limiting the number of doctors on their panel, and so that's why they do it. They don't care about the patient. That's not what's important, and that's what I want to stress with y'all. This is business. This has nothing to do with what your choices are and what you care about. Even though you're the one paying them, it's all about the dollar. So on to the topic at hand. Our second opinion today is about high blood pressure, but not just high blood pressure. It's about a hypertensive emergency. In other words, at what point should you run to the emergency department? You know, just because your blood pressure is elevated means nothing. If your blood pressure is elevated and you have chest pain, if you have stroke-like symptoms, you have heart failure, if you have kidney failure, something else going on, then that would warrant a visit to the emergency department. Now, but that's not because of your blood pressure, that's because of the other symptoms. Dr. Knox, who was a guy at Emory, actually did research and proved that ER doctors that were aggressive at treating blood pressures on patients that didn't have symptoms, we were actually making things worse. And so unless they're having symptoms, a good ER physician won't be aggressive at treating the blood pressure. Give you an example. A doctor from upstairs called and said, hey, I got a patient, their blood pressure is 195 over 100, I'm sending them to the emergency room. I'm like, wait a minute, what are their symptoms? And no symptoms. And I said, why were they there today? Oh, just routine follow-up. Then I says, well, then just treat the blood pressure. Well, unfortunately, by that time, the patient rolls up in front of me. They'd already sent him down. So I told the lady, I said, ma'am, this is by no means an emergency. What's going to happen to a patient if you panic as a doctor and say, oh my God, I got to send you to the emergency room. You got a high blood pressure. What does that do? It makes your blood pressure go up. So the lady comes in and I tell her, ma'am, I'm going to put you in this bed right here. I'm going to let you sit there for 20 minutes and we're going to come back and recheck your blood pressure. It's going to be fine. We have nothing to worry about. There's nothing alarming, and then we'll send you home. And sure enough, 20 minutes later, I come back, her blood pressure was still elevated, but it was like 160 over 80. And I says, you're fine, go home. So panicking doesn't make the blood pressure better. If you check it at home and it's a little bit elevated, check it again. Relax, take a deep breath, and check it again. Most of the time, the blood pressure will come down. Check it even a third time if it's still up some. But if you're not having other symptoms, it does not warrant a trip to the emergency department. Like I said, a good ER physician wouldn't treat that. They would look at you, pat you on the back and reassure you and let you go home. Another patient I had came in, this is the office here, he was on 3 blood pressure medicines. His blood pressure was elevated. So I adjusted his medicines, brought him back, still elevated. Added a medicine, brought him back, still no difference. And it finally dawned on me. I said, you know what? I don't think I'm treating the right problem. I said, what's going on in your life? And he actually broke down right there in front of me. And he was going through a divorce. He was worth a lot of money. And that's what was driving his blood pressure. So you shouldn't treat high blood pressure when it's not a high blood pressure problem. The high blood pressure in his scenario was a symptom, not a disease. And so you treat the stress, you treat whatever else is going on, and the blood pressure will come down. I had a patient that was in the operating room and getting ready to have surgery. The surgeon called me and said, hey, this guy's blood pressure's through the roof. What am I supposed to do? I said, give him something to relax him. I said, this guy's got terrible anxiety. He's probably scared to death. Give him something to relax him. He'll be fine. Well, I find out 2 weeks later, they didn't do that. Anesthesiologist sent him to the emergency department. And he got a $5,000 bill unnecessarily. And so it's unfortunate when these scenarios happen where even anesthesiologists don't know how to handle blood pressure. I think high blood pressure causes a stroke. That's really not mostly the case. Most of the time the blood pressure goes up because of a stroke. That's the brain trying to push blood into the areas of the brain that aren't getting blood flow. That's called a Cushing effect. So after a stroke, the blood pressure goes up. It's typical. And you definitely don't want to treat that unless it's extremely high. So bottom line, relax, take a deep breath, and most of the time the blood pressure is not a big deal. I got another patient this is back during my residency. He says, "Hey doc," calls me over. He says, "Come here." And so I walk over. I said, "Yes, sir. What's wrong?" He says, "I just heard my alarm go off on my monitor. Should I be concerned?" And I says, "No, sir. You should be concerned when you don't hear your alarm going off on your monitor." This is Gary Orris with another Second Opinion. Thank you.